In the healthcare system, the health of our patients is our first priority. And unfortunately, increase in temperature of our planet and wild weather patterns are having a real impact on the health of our patients. Equally, air pollution has a significant impact on the health and well-being of our patients. But aside from that, the provision of care in itself has a significant impact on Australia's total carbon footprint, and we need to be part of the solution. 7% of Australia's carbon emissions, or around the entire output of South Australia, for example, is caused by the health sector, and medicines makes up about 19% of that, so around a fifth. So we, as the health sector, have to also take responsibility to do what we can to reduce our impact on carbon emission in Australia. The National Health and Climate Strategy, recently launched by the federal government, is exciting because it talks about the need to be led by sustainability thinking in everything that we do. This is really important. PSA's position statement is a comprehensive one looking at a number of the areas, and it is really good in validation to see those areas again reflected in that strategy. Whether that be about taking account of your own impact or what you can do there, whether it talk about the need for collaborative relationships, or that talks about the use for more rational use of medicines. One area of that, for example, might be inhalers and the use of gases in our health system. Others can include energy audits of your own company, or looking at the impact of travel, whether that be commuting or business travel within your organisation. If we think about what, as an individual pharmacist, I can do to contribute, that will really depend on the role that you have in the sector. Our minds will often quickly go to things like waste management. We can see and feel that. So whether that be recycling systems, whether that be participating in return of blister packaging, because it can't just be recycled in general household waste, whether that be looking at ways to reduce the carbon footprint of that one business that you're working through, LED light replacement, for example. All those really good hygiene things we can do at an individual level. But perhaps one of the surprisingly most powerful things we can do is just all rational medicine use. If we're using medicines unnecessarily because people's health conditions aren't being well managed, we're using more medicines. Those medicines have a carbon footprint. You may be able to talk to suppliers about your expectations for sustainable care. You may be in a position to take initiatives that reduce the carbon footprint of the nature of the services that you provide. The more senior you are in your role, the greater the obligation there is placed upon you to play your part in reducing carbon emissions. I think most health professionals would be shocked to know that the amount of carbon emissions contained in the production of one MDI metered-dose inhaler canister is about equivalent to driving between Canberra and Sydney, so 300 kilometres. I think most people will communicate that have sort of taken a step back and go, wow, that's a lot, and it is. The industry is responding, and we're seeing a shift towards lower carbon emission inhalers, and this is really important. Inhalers have a significant impact relative to other medicines. The dry powder inhalers, unlike other inhalers, have a couple of advantages. One is that they're recyclable, and the second is that they don't have the same carbon footprint as some of the propeller-based inhalers. We're also seeing a shift towards reusable canisters, and I think pharmacists who work with patients who've used those reusable canisters had really, really positive responses because people feel they're making a positive contribution to reducing waste associated with their medicines. For some people, reducing their environmental footprint is an important motivator. For other people, they don't like having to have so many cartridges go into the bin or inhalers going into the bin. So it's about finding an individual's motivation, but ultimately, every part of rational medicine's use is about keeping people safe and healthy. People, if their lungs are inflamed and they can't breathe, that's a really horrible situation to be in. And it's much nicer to have a well-controlled condition. It's better for the patient's quality of life. It's better for them being a contributing member of society. And ultimately, we'll have a better climate outcome as well.